Hi Muskies, my name is Leah Shire and I'm a counselor here in Counseling Services. Today I'm going to teach you 3 different breathing techniques to help when you're feeling stressed or anxious or just to kind of help maintain an overall sense of calm. So the first one is called box breathing or 4-point breath. And it's exactly how it sounds. And this can kind of help you stay calm, breathe deeper, and it can help you improve your overall sleep and just your health in general. So 4 points, like I mentioned, and so it's exactly how it sounds. So you would inhale for 4 counts, hold the breath for 4 counts, and then exhale for 4 counts, and then hold for an empty state for 4 counts. And then you would try to repeat this for a couple of minutes, and it's just the idea of slowing down your breath, slowing down your heart rate, and regaining to a sense of the normal breath when a lot of times when we're anxious or stressed, our heart rate is up, and so this is to kind of help maintain a sense of calm. So I'm going to demonstrate it for you. And so again, we're going to inhale on 4 breaths, and then hold for 4 breaths, exhale for 4, and then hold for an empty state for 4 counts. So I'm going to go ahead and do that. So if you want to watch, you can try along just to see how it feels like. So here we go. Okay, and then in the empty space or the empty state, you may need to take a couple little breaths in between, depending on your breath cycle. But that way you're not holding your breath when you're trying to inhale as well. So, um, and also if 4 counts is a little bit too much for you, that's totally fine. Like trying just 2 counts or 3 counts and work your way up to 4. But again, it's just to kind of taking the slow, deep inhales in through the nose and exhale out of the mouth. So the next one is abdominal breathing. And this works best when you're stressed, anxious, maybe right before an exam or a presentation. And so this is going to be the deep belly breathing. And so um, depending on the situation and depending on where you are, you can do it while you're sitting up or you can do it lying down. If you do it lying down, it's easier to feel the rise and fall of your belly as you're breathing in and out. So what you want to do is you're going to place one hand on your chest and then one hand on your belly. And so as you inhale, your belly is going to expand out. And then as you exhale, you're going to tighten the muscles in your stomach and pull your belly in. Okay, so if you want to go ahead and try that, I'll do that a couple times. So we're inhaling, our belly is going out, and then we're exhaling, and we're pulling our belly in. So let's do that a couple more times. Okay, and so the idea or goal to work towards is doing that for 6 to 10 breaths per minute. And maybe working up to like 5 or 10 minutes. So again, depending on your time or where you are or how you're feeling at the time, it's going to depend on how long you have the time for breathing. So again, it's just kind of slowing that breath and really focusing on the rise and fall of your belly again to kind of get that focus on the way that your belly is moving versus like what's going on up in your head. Okay, and then the next one is called alternative nostril breathing, and this is a breathing practice that is commonly used in yoga, but it's used to if you need to focus or kind of energize, you're feeling sluggish and you want to feel a little bit more awake. It brings balance and unites the right side of the brain and the left side of the brain. So I'm going to explain to you how you do it, and then it might be easier for this one just to kind of watch. And so you're going to hold the right thumb on your right nostril and inhale through the left nostril. And so at the peak of your breath, your inhalation, you're going to close the left nostril with your pointer finger or your middle finger or whatever finger that you can use to cover that nostril. And then you're going to exhale through your right nostril. So that might be a little bit confusing. So I'm just going to go ahead and show it to you, and then I'll tell it to you again. Okay, so the idea is to continue to breathe out of your nose instead of letting the breath out of the mouth. So you're just alternating nostrils, and you may feel a little bit nasally. When you do that, it's totally normal, and so you're working on clearing those nasal pathways in order to kind of breathe better. Kind of helps you energize and